Stop searching for NCLEX PDFs. Watch this practice exam instead. Question 1. After a liver biopsy, place the patient in which of the following positions? Option A, left side lying with the bed flat. Option B, right side lying with the bed flat. Option C, left side lying with the bed in semi-Fowler's position. Option D, right side lying with the bed in semi-Fowler's position. The correct answer is option B, right side lying with the bed flat. The liver is on the right side of the body. Positioning the patient flat on their right side uses their own body weight to apply direct pressure and prevent lethal hemorrhage. Question 2. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Option A, nutrition management. Option B, fluid and electrolyte balance. Option C, management of hypoglycemia. Option D, pain control. The correct answer is option B, fluid and electrolyte balance. Acute pancreatitis causes massive systemic inflammation and capillary leak, leading to profound hypovolemic shock. Fluid and electrolyte resuscitation is the absolute life-saving priority. Question 3. After surgical repair of a hip, which of the following positions is best for the patient's legs and hips? Option A, abduction. Option B, deduction. Option C, prone. Option D, subluxated. The correct answer is option A, abduction. Keeping the legs abducted, spread apart, using an abductor pillow prevents the newly placed hip prosthesis from popping out of the joint capsule. Question 4. When giving intravenous phenytoin, which of the following methods should you use? Option A, use an inline filter. Option B, withhold other anticonvulsants. Option C, mix the drug with saline solution only. Option D, flush the intravenous catheter with dextrose solution. The correct answer is option C, mix the drug with saline solution only. Phenytoin is highly unstable and will immediately crystallize and occlude the intravenous line if mixed with any solution containing dextrose. It must only be mixed with normal saline. Question 5. A hospitalized patient is receiving packed red blood cells for treatment of severe anemia. Which of the following is the most accurate statement? Option A, transfusion reaction is most likely immediately after the infusion is completed. Option B, red blood cells are best infused slowly through a 20-gauge catheter. Option C, red blood cells should be flushed with a 5% dextrose solution. Option D, a nurse should remain in the room during the first 15 minutes of infusion. The correct answer is option D. A nurse should remain in the room during the first 15 minutes of infusion. Most severe, life-threatening ABO incompatibility transfusion reactions occur within the very first 15 minutes, requiring the nurse's direct presence and constant monitoring. Question 6. A clinic patient has a hemoglobin concentration of 10.8 grams per deciliter and reports sticking to a strict vegetarian diet. Which of the following nutritional advice is appropriate? Option A. The diet is providing adequate sources of iron and requires no changes. Option B. The patient should add meat to her diet. Option C. The patient should use iron cookware to prepare foods. Option D. A cup of coffee or tea should be added to every meal. The correct answer is option C. The patient should use iron cookware to prepare foods. Cooking highly acidic or moisture-rich foods in cast iron skillets physically leaches dietary iron into the food, providing an excellent supplement for vegetarians. Question 7. A patient received surgery and chemotherapy for colon cancer. At a follow-up appointment, she complains of fatigue and difficulty with concentration. Which is the most likely explanation? Option A. The symptoms may be the result of anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be the result of anemia caused by chemotherapy. Chemotherapy is highly toxic to rapidly dividing bone marrow cells, frequently resulting in profound, lingering anemia that causes fatigue and poor concentration. Question 8. A clinic patient has recently been prescribed nitroglycerin for treatment of angina. He calls the nurse complaining of frequent headaches. Which of the following responses is correct? Option A. Stop taking the nitroglycerin and see if the headaches improve. Option B. Go to the emergency department because nitroglycerin causes brain bleeding. Option C. Headaches are a frequent side effect of nitroglycerin because it causes vasodilation. Option D. The headaches are unlikely to be related to the nitroglycerin. The correct answer is option C. Headaches are a frequent side effect of nitroglycerin because it causes vasodilation. Nitroglycerin works by rapidly dilating all blood vessels. The sudden dilation of cerebral vessels frequently causes pounding, throbbing headaches. Question 9. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions should the nurse perform first? Option A. Ask the patient to lie down on the exam table. Option B. Draw blood for a chemistry panel and arterial blood gas. Option C. Send the patient for a chest X-ray. Option D. Check blood pressure. The correct answer is option D. Check blood pressure. Taking vital signs, specifically blood pressure, provides immediate, baseline physiological data to determine the severity of the heart failure exacerbation. Question 10. A patient arrives in the emergency department with symptoms of myocardial infarction, progressing to cardiogenic shock. Which of the following symptoms should the nurse expect? Option A. Hypertension. Option B. Bradycardia. Option C. Bounding pulse. Option D. Confusion. The correct answer is option D. Confusion. Cardiogenic shock causes a massive drop in cardiac output. The brain immediately suffers from hypoperfusion and hypoxia, resulting in rapid confusion and altered mental status. Question 11. Following a myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises and ambulate. Which of the following reflects the purpose of exercise? Option A. Increases fitness and prevents future heart attacks. Option B. Prevents bed sores. Option C. Prevents deep vein thrombosis. Option D. Prevents constipation. The correct answer is option C. Prevents deep vein thrombosis. Prolonged bed rest causes blood to pool in the lower extremities, venous stasis. Early ambulation physically pumps the blood back to the heart, preventing deep vein thrombosis. Question 12. Tissue plasminogen activator is considered for treatment of a patient with myocardial infarction. Which of the following is a contraindication for treatment? Option A. Worsening chest pain that began earlier in the evening. Option B. History of cerebral hemorrhage. Option C. History of prior myocardial infarction. Option D. Hypertension. The correct answer is option B. History of cerebral hemorrhage. Thrombolytics completely dissolve clots system-wide. A history of cerebral hemorrhage is an absolute contraindication as it carries a massive risk of rebleeding in the brain. Question 13. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A. Obesity. Option B. Heredity. Option C. Gender. Option D. Age. The correct answer is option A. Obesity. Unlike genetics, gender, and age, a patient has the power to modify, treat, and completely change their weight and obesity status through diet and exercise. Question 14. A nurse is administering intravenous furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected? Option A. Increased urinary output. Option B. Decreased edema. Option C. Decreased pain. Option D. Decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a potent loop diuretic that pulls fluid out of the body, lowering blood pressure and edema. It has zero analgesic properties, so decreased pain is not expected.